Alright, let's discuss about the disorders of the experience of self. Now this term disorders of the experience of self is given in Fisher psychopathology. Sims for the same chapter uses the term the disordered self, one and the same thing, just difference of word usage. Let us talk about some of the concepts first. Self. What exactly is self? What is the definition of self? That's a difficult question. Even if I ask you, define yourself, who are you? You would struggle for the answer, right? Similarly, it has been very difficult to give a proper definition of self, to the extent that even till today we do not have any consensus. There is no universally accepted definition of self. This is what is written in your books also. But still, if somebody asks you what is self and somebody pushes you, now there is a researcher by the name of Zahavi who has worked extensively in this field, and Zahavi has given multiple views. One of the views given by Zahavi is self is the very subjectivity of experience. Self can be defined as the very subjectivity of experience. What does it mean? Look at two terms. Subjective experience. Self is the subjective experience. Everything happening inside me, around me, outside me, everything put together, when subjectively experienced by me, that subjective experience is self. And what is the corollary to this definition? That if there is no experience, there would be no self. Because we are defining self as the subjective experience. So if there is no experience, there is no self. Which means, according to this view, self does not exist independently. It is dependent on experience. But again, I would repeat myself. There is no consensus definition. This is one of the views, but a view which we can understand, right? For the sake of understanding, we can say the subjective experience is self. Because it has been so difficult to define self, the second best thing that we did was we defined the characteristics of self. Self constitutes these 5 things, right? So we'll talk about the characteristics of self a bit later. The good thing is, on the basis of characteristics only, the disorders have also been defined. Now the term ego and the term self are used interchangeably, right? So do not get confused in that. For many of these concepts, we have German terms. So the German term for self-awareness or ego consciousness is Ich-Bewusstsein. If one of your professors or some of your professors like asking German words, just remember this word. Whenever we have a discussion on self, one of the very important concepts that we have to discuss is the Cartesian dualism or Descartes dualism. Descartes was this famous philosopher who gave a very important concept in which he separated the body and the mind. So he gave the terms res cogitans. These are Latin terms, and res extensa. So what is res cogitans? The thinking substance. And what is res extensa? The extended substance. So what do these correspond to? The thinking substance corresponds to, you can call it mind or you can call it self. And this is body. You must have come across this term mind-body dualism, right? That is nothing but this. So basically Descartes, the correct pronunciation is Descartes, he said that the self and the body are two separate entities. They are two separate, distinct entities. The self does not take any space. The body or the res extensa, of course, takes space. The mind or the self cannot be divided. The body can, of course, be divided. But the important thing was, he said that these are two distinct, two separate entities. Descartes believed that the mind can exist even without the body, or the self can exist even without the body, but the vice versa is not true. So this is what Descartes believed, and even till today that is the conventional way of thinking, right? We often think that the self, the thinking part, is different from the body, right? We have a mind, we have a body, it is separate. But the current understanding is different. Now we say that the self is embodied. What does it mean? The self is embodied. What does it mean? That the physical body, the physical structure that we have, it influences everything about self. So, in other words, the physical structure, the physical body influences all the characteristics of self. Influences all the characteristics of self. What kind of characteristics? Like thinking, like language, like memory. What is the meaning of this line? Self is embodied means physical body influences all the functions of your consciousness, all the functions of self, like thinking. What does it mean? For example, say if my hand gets injured and if I'm having pain in my hand, now I'll be thinking about the pain. I'll be thinking about what caused this pain. I'll be thinking about how can I relieve this pain. I'll be thinking about what can I do to prevent this pain from happening in the future. So your body is having a direct impact on your thinking. Another example, say you're hungry, your body is hungry. Now your mind is constantly thinking about food. So basically, the self is embodied means your body is going to have a direct impact on the thinking self as well. So basically what we are trying to say is they are not separate. Unlike what Descartes said that body and mind are separate, they are not separate entities. In fact, body and mind or body and self are inseparable. They are inseparable entities. We can say that if there is no body, there can be no self. Without body, there can't be any self. In fact, when we define what is self and what is non-self, we do it on the basis of body, right? This is my body, this is me, and this is outside the body, this is not a part of myself. So to differentiate self and non-self also we are using the body. So how can we say that self and body are different? Self and body are separate entities? No, self and body are inseparable. They are totally intertwined. In fact, even Descartes believed that though self and body are different entities, they do interact. And he used to believe that the interaction happens through pineal body. We now know that that is not true, but that is what Descartes believed, right? So you understand Descartes dualism or Cartesian dualism or mind-body dualism, and you also understand that now the understanding is that body and self are not distinct entities. They are intertwined, they are inseparable. In fact, there is no self without the body. Let us understand a bit more about the body experience. Why is it unique? The body experience is unique because we can have a subjective experience and another kind of experience where the body is experienced as an object. What does it mean? Say this hand of mine, right? Now this hand of mine, my experience is that this hand of mine is integrated with the rest of my body. This hand of mine is integrated with the rest of my body, which in turn is integrated with myself, the self, right? So this hand is a part of the body and that body is integrated with the self. This is the subjective experience that I have. Also, usually my awareness does not go to different parts of my body. I am not consciously thinking about where my feet are, where my fingers are, where my thumb is. We consciously do not think about these things. We are not even aware of these things. We just take our body for granted. This is one type of experience, right? Secondly, we can also experience the body the way we experience an object. For example, this pencil. This pencil is an object, right? If I have to define this pencil, or if I have to say a few words about this pencil, I would say it is white in color, the cap is missing, it is used for drawing or writing, right? I'm defining it as an external object. Sometimes we can also experience parts of body as an object. Like, let's go back to the hand. Again, let's say I have an injury in my hand. I have an injury in my hand which is causing pain. Now I feel that this hand is distinct from the rest of the body because this is the part of the body which is causing pain. This is what is causing pain, and it is distinct from and separate from the rest of the body. I will say my hand is paining. My hand is paining. Or say if I'm having palpitations, I'll say my heart is pounding. Right? So when I delineate my hand is paining, or when I delineate my heart is pounding, now I'm not integrating it with the rest of the body. I'm singling it out the way I single out a particular object. So we can experience the body in a subjective way, and we can also experience the body as an object with a material value which is distinct. All right, few more terms, slightly confusing, but stay with me. Self-concept and body image. Now these are important clinically also. Let's first talk about the self-concept. Self-concept is the fully conscious and abstract awareness of self. An abstract awareness of self. Right? For example, the characteristics that I give to myself will be a part of self-concept. It would include my identity, the value system, the belief system, the ideas that I follow. Say a person comes and says, my name is Ramesh. I am a carpenter. I am 35 years old. I live in a village. I am a religious person. I am a spiritual person. I believe in kindness. I am an animal lover. All these things would form the self-concept of Ramesh. Right? All the abstract things that the person is aware about himself, that is a part of self-concept, right? But when we talk about body image, now we are talking more about the physical body, right? So it is concerned with the physical matter and the awareness, experiential awareness of body. In very simple terms, my body image is the way my body is perceived by me, the way in which one's body is perceived, the way I perceive my body. The same Ramesh can say that I am 5 feet tall and I am very fat and my toes are very small, my nose is very small, right? So all this description is about the physical part of the body, physical matter, the body, right? Now why are these two concepts important? When there are disturbances of self-concept, when you are not really sure who you are, that can lead to different kind of psychopathology. And when there are body image disturbances, it can lead to different kind of psychopathology. For example, borderline personality disorder. People who have borderline personality disorder, they are not really sure about their identity. They are not really sure about their goals. They are not really sure about what they want from their life, right? All that is coming as a disturbance of self-concept. And people who have, say, BDD, body dysmorphic disorder, they have a disturbance of body image. They feel that their nose is long, their hair are ugly, their lips are thin, right? The way they are perceiving their body, that is disturbed. So disturbance of self-concept and disturbance of body image. This is the clinical relevance. Now we also have something called as body schema. Body schema is spatially a bigger construct than body image. Spatially a bigger construct than body image. Although, again, these terms are used interchangeably. But strictly speaking, body schema would include other things. For example, the clothes that you wear, right? The spectacles, say the watch, right? So it is including things beyond your body. And it changes. For example, say if you are driving a car. Now, while you are driving a car and while you are judging whether you can park your car in a particular space or not, you are not only considering yourself, you are considering the car as well, right? In that moment, the car also becomes a part of your body schema. So body schema, the construct is spatially bigger than the construct of body per se. Let us discuss about these characteristics. So Jaspers gave 4 characteristics of self or self-awareness or self-experience. These terms are used interchangeably. Please do not get confused in these terms. They mean one and the same thing. So Jaspers gave 4 characteristics. The first one is awareness of existence and activity. Awareness of existence and activity. Now, some researchers have proposed that we divide these 2 halves into 2 separate characteristics, so that awareness of existence is a different characteristic and awareness of activity is a different characteristic. So if we divide this first point into 2 points, then we end up having 5 characteristics of self-awareness or self-experience. So awareness of existence, also called as ego vitality. Ego vitality. So what is the meaning of ego vitality or awareness of existence? I as an individual am aware that I exist. I know that I exist. This is the awareness of existence. Now let's take the example of a patient who has nihilistic delusions. We'll talk about these things in more details when we talk about the disorders, but just for the sake of discussion, somebody who has a nihilistic delusion, who says that I do not exist, I am dead, everyone is dead, my organs are rotting. Basically, this individual is having a disturbance of awareness of existence. He does not believe that he exists anymore, or he believes that partially he has stopped existing, right? So this is the meaning of awareness of existence, that I exist. Awareness of activity, also called as ego activity. What is awareness of activity? That I am the agent who takes actions. I am the agent who does activity. I am the one who takes actions in accordance to my thoughts. For example, if I want to lift this pencil, it's me who did this activity. I am the one who is doing this activity. We have this feeling, right? That we are the ones who is driving the activity. So this is the meaning of awareness of activity or ego activity. As you can guess, a patient, say, who is having maid volition, one of the SFRS, Schneiderian first rank symptom, a patient with maid volition feels that certain actions are being forced upon him. The patient may say that I am lifting this pencil, but it's not me who is doing it. Somebody is making me do it. This patient clearly has an abnormality of awareness of activity. Awareness of unity. Awareness of ego unity, also called as ego consistency and coherence. So what does it mean? It means that I am one person. I am one person. I am a singular person. There is unity. Myself is a single unit. All the aspects of myself are integrated well, leading to the formation of a single unit. This is the meaning of ego, consistency and coherence. So I am one person. Say there's a patient who has, say, multiple personality disorder. For this patient, this awareness of unity is disordered, because this person may feel or may experience that there are multiple aspects of self which may not even know each other. There are multiple units of self. It's not a singular unit. This is the meaning of awareness of unity. Then we have awareness of continuity of identity. Continuity of identity, also called as ego identity. As the name suggests, that the awareness that it's the same person. I am the same person. 20 years back, the person who was in a medical college, 10 years back, the person who was doing his MD, 7-8 years back, the person who started his clinic, 5 years or 8 years back, the person who started a different platform, all these things was me only. I was the same person. I am the same person who was there in 2005 also. I am the same person who was there in 2014 also. I am the same person in 2025. My identity continues to be the same. I am the same person. I am one person and I am the same person. Now, there are patients who have schizophrenia, who have disorders of awareness of continuity of identity. They may claim that they were very different people in the past and now they are a different version. They are a completely different person. We'll talk about these disorders in details in the coming slides. But let's first complete it. The last one is awareness of separation from environment. Separation from environment or boundaries of self. Boundaries of self, also called as ego demarcation. Ego demarcation. So, as you could have guessed by now, awareness that till where I exist and from where the non-self starts. How am I different from? How am I demarcated from? How am I separate from the environment? This is me. This is a part of environment. In patients who have schizophrenia, the disturbance of ego demarcation is often very pronounced, right? When people say that I'm hearing voices, I'm hearing certain voices, basically some activity that is happening internally is being ascribed to from outside. It is said that some activity, the activities which was happening internally, the patient perceives it as if it is happening from outside. So what is me and what is outside, that demarcation gets blurred. And that is why something which is internal is felt as if it is happening from outside. So this is a disorder of ego demarcation. Right? So these are the 4 characteristics of self-experience. And if we divide ego vitality and ego activity separately in 2 parts, then we have 5 characteristics of self-awareness or self-experience. Let us talk about the disorders of ego vitality and ego activity. The first one is very straightforward, the nihilistic delusions. The nihilistic delusions. The patient has a belief that I do not exist. I do not exist, which is clearly a disorder of awareness of existence. Even if the patient says that some of my organs are rotting away, although he is denying the existence in a partial manner, still it remains a disorder of ego vitality. Disorder of ego activity, your delusion of control, the passivity experience. The patient says that my action is not controlled by me. Somebody else is controlling my movements. That clearly becomes a disorder of ego activity. What else? Loss of emotional resonance. I cannot feel, which usually happens in patients who have depression. The patient is not able to feel happy. The patient has kids coming over, grandkids coming over, not able to feel happy, which makes him feel guilty also, right? So I am not able to feel anything. I used to be the person, I used to be the agent who could experience emotions. I cannot experience emotions. So loss of emotional resonance seen in patients with depression. In depression, the patients can also say, I can't think. I am not able to think. Especially in patients with severe depression can say, I can't think. I can't do anything. All of these are again disorders of ego activity. Depersonalization. Let us talk about depersonalization in more details. Now, depersonalization is a confusing topic. Not only topic-wise, even when a patient is experiencing symptoms of depersonalization, Sometimes they struggle in describing it to the clinician. Sometimes clinicians struggle in asking the appropriate questions when they are trying to elicit the symptoms of depersonalization. So let us understand this topic. In very simple terms, if I have to explain it, I would say depersonalization is the feeling of unreality of self. Feeling of unreality of self. The patient feels as if he is unreal. And what is derealization? Feeling of unreality of the external world or external environment. But if we are asked about the definition of depersonalization in the exams, so then we have to give a more formal definition. I will go with the definition given in Sims. It's a much better definition. So it says that, and Sims has taken the definition from Sidman. So it says that depersonalization is a peculiar change in awareness of self. Peculiar change in awareness of self in which individuals feel as if they are unreal. Again, the same thing. The individuals feel as if they are unreal, right? So it's a change in awareness, of course. The person is feeling unreal. But here, this as if is very important. In fact, depersonalization and derealization are often called as if phenomena. So this is the definition of depersonalization. In the same definition, if we say it's a peculiar change in awareness of self in which individuals feel as if the external environment is unreal, that becomes derealization. When it comes to self, depersonalization. When it comes to the environment, it becomes derealization. Now, depersonalization and derealization almost always occur together. Almost in more than 3/4 of the cases, depersonalization is followed by or is accompanied by, or there is occurrence of both these phenomena together. Depersonalization alone may happen, derealization alone may also happen, but usually they occur together. To the extent that many of the definitions of depersonalization also take into account the external environment component. So clinically they are difficult to differentiate. Usually they occur together. Even the disorders, both in ICD, ICD-11 and DSM-5-TR talk about depersonalization / derealization disorder, telling us that they usually occur together. Now let us understand it a bit more. First of all, we have to focus on this term as if. What is the meaning of this as if? Why do we call it as if phenomena? The patient comes to you and he says, "Doctor, I feel as if I am unreal." Why patient is saying as if? Because patient knows that in reality nothing has changed. It's not that he has become unreal. In the literal terms, nothing has changed. He is using the word as if just to explain that experience, that I feel as if things have changed despite me knowing that nothing has changed. So this as if is used to denote that reality testing is intact. The patient's reality testing is intact. Patient knows that nothing really has changed. This is what just he is experiencing, and that's why we use the term as if phenomena. So reality testing is intact, and we do not use this term depersonalization for psychotic experiences. Say a person has delusion of nihilism. The patient believes that he does not exist. Even that is a disturbance of awareness. But for that, you would not use the term depersonalization. We don't use the term depersonalization for psychotic experiences or where there is a delusional elaboration involved. Only when the reality testing is intact, only when we are sure that it's an as if phenomena, we use the term depersonalization. Although Fish clearly says that sometimes delusion of nihilism is also called as delusion of depersonalization, but it is better avoided. Just for the sake of completion, I am writing delusion of nihilism is sometimes also referred to as delusion of depersonalization, but we should avoid it. Now, depersonalization is usually an unpleasant experience. Although there are some nuances here, and we will discuss about these nuances in the later slides, usually it's an unpleasant experience. Now, let us try to understand depersonalization better. What exactly are the symptoms? See, we have a feeling of familiarity for ourselves. We are familiar with our body. We are familiar with our thought process. We are familiar with our emotions. For example, say, let me talk about my thinking process. Say, if I have to think about the country India, I know that usually I'll get thoughts like that. I love my country, but I'm very unhappy with certain aspects of our country. I'm very unhappy with the fact that other countries have gone ahead of us. All these things are a stable part of my thinking process. If I am thinking about the country, these are the thoughts that are usually likely to come in my head. So I'm familiar with my thinking pattern when it comes to my country. So would you be? So would be you, right?